Tonight continues now. Good evening, and thanks for staying with us at 7:30. The gift of life, pregnancy, and starting a family is one of the most exciting moments for any couple. A mini version of yourself and your partner full of hope and promise. But the reality is many families experience pain, neglect, and loss during what should be one of the most joyous times of their lives, especially Black families. This week marks Black Maternal Health Week, and it's also a call for action to level the playing field for Black mothers, making sure they have healthy pregnancies. Right now, about 700 women die during childbirth or soon after every year, according to the CDC. But that only tells you part of a sad story. Black women in the U.S. are 3 times more likely to die from pregnancy-related complications than white women. 3 times more often. Dealing with the loss of a loved one during childbirth is a pain Charles Johnson knows all too well. In 2016, he lost his wife and mother of his children during what was supposed to be a routine C-section.
The doors to the operating room opened and they closed behind Kira. That's the last time I saw her alive. Every time I share my experience, it's extremely painful. It's literally the worst thing that's ever happened. But my hope is that by telling the story, it will help prevent what happened to our families from happening to other families.
Studies show Black women are often dismissed or ignored in hospitals when they suffer some pregnancy complications. In 2017, the executive board of the American College of Obstetricians and Gynecology acknowledged that in its policy statement, saying medicine is beset with implicit and explicit racial bias. The field of obstetrics and gynecology has engaged in practices that were very harmful to women of color. Dr. Ebony Parson is an OBGYN with Novant Health, and we asked her to explain some of this bias.
I think that what we have noticed is that sometimes the care that we are providing to patients varies, and sometimes that variability is based on implicit bias that we're not aware of. And if that happens, then how are we ensuring that the interventions and the care that we're providing is equitable for all women? Again, not always intentional, but can have effects. We also have comorbidities. Black women have a higher rate of obesity and chronic conditions such as hypertension and diabetes, and those things can increase the risk and rate of complications in pregnancy. And then access to care, having early time-sensitive access to care for a pregnant woman is very key and not always a given for these women.
Does diversity in the medical profession itself help in that?
Absolutely. Absolutely. I think that diversity in general, whether that be racial, age-based, cultural, these things are important.
Are you finding are Black women reluctant to go to the doctor, or are they going to the doctor and being ignored?
I don't think that that is a black and white answer. You know, I think that there is some distrust of the medical community by patients, particularly if a patient does not feel that they are being seen or heard. And so we are trying to make sure that we're increasing our communication and our relationship with the community so that they feel comfortable and heard when they are being seen. And then when they're there, obviously, again, we are trying to provide good quality care to these patients. And so our intent is for them to be heard. But again, maybe we need to look at it. Maybe what we thought we were doing, we're not doing or doing as well as we had hoped.
80% of pregnancy-related deaths in the U.S. are preventable. So what are the urgent warning signs that we're missing?
So I think it can vary based on the woman and what's going on. But I think any pregnant woman who has new headaches, blurred vision, chest pain, shortness of breath, those things need to be evaluated. So don't write those things off. Don't think that, oh, this is nothing. Call your provider and be seen so that we can evaluate you in a timely manner.
When you see these numbers we're talking about, how frustrated are you that we're not making more progress?
You know, I think we're all frustrated. You know, it's so multifactorial. And so, and all of it is urgent and needs to be dealt with. And so, yes, I think that we can do a better job having these conversations, addressing these things are important. Also encouraging patients to talk about their health before they're pregnant. Maternal health starts before the pregnancy, in my opinion. And so what are they doing between pregnancies that we can help optimize their health so that a healthier patient becomes pregnant?
You heard her say it's urgent. One pathway to help Black women before, during, and after pregnancy is support from a doula. Recent estimates from Donna International show there are around 14,000 registered right here in the U.S. Now, if you're not familiar, a doula is a person who provides emotional and physical support to you during your pregnancy and also your childbirth. They don't deliver babies or provide medical care, but they can step into a role that allows them to advocate for a mother when she is at her most vulnerable. I want to introduce you to Kira Kimball. She's been a certified doula for more than 10 years here in the Charlotte area. Kimball is the founder of the Mind RT Doula Company. Her team works in a variety of settings, including hospitals, birth centers, and private homes.
So we start working with clients from the very beginning. Sometimes we work with them while they're still trying to conceive. And we build these relationships with them throughout their pregnancy, where we have a trusting relationship, where we are providing them information that they know that they can rely on. We are with them throughout their pregnancy, throughout their birth, and then we stay with them during the first few months postpartum. So when they are released from the hospital and there's a 6-week wait until they see their provider again, we are there during those 6 weeks. We're checking in with them. We're coming to visit them. We're looking at them and their babies and talking about what normal recovery is and what are some of the warning signs that they need to address and not wait until that 6-week visit. So if they're experiencing those warning signs, we know we don't want to leave their baby and go to the emergency room, but doing that, it can be life-saving. So we are there to fill in the gap and help them save their lives during that delicate time from the time that they're released from the hospital and they go back for follow-up care.
Massively important. In a sit-down interview, WBTV's Siobhan Bryan asked Kimball about her journey to becoming a doula. Take a listen.
So what made you enter this profession?
That's a long story. So I entered this profession after having my own children and really kind of gathering information and being a source for other mothers that were having children after me. So I had amassed a great deal of knowledge and wisdom about childbirth, child rearing, and so I wanted to make sure that I was assisting clients and assisting potential clients on how they can also have empowering births.
So have you seen a rise in people interested in doulas, especially Black mothers, since 2019?
Absolutely, absolutely. I've seen we do have research that show, particularly since 2019, that disparity, that gap in care and outcome has increased. And I think more Black women are taking charge of their care and wanting to save themselves. So they are reaching out more to doulas, making sure that they are arming themselves with knowledgeable resources that are working on their behalf that can help them navigate the healthcare system. We do research for them. We help them gather the information so that they can have meaningful conversations with their care team. We facilitate that communication by making it their voice heard and making sure that they are acknowledged and having an input in their care.
So what would you say to someone who's saying they wonder if they need to look into considering a doula for themselves?
I have never seen someone not need support. So I think if you need anyone needs support. And that support can look in different ways. Sometimes you need someone who's knowledgeable and that can help you navigate the system. Sometimes you just need someone who's experienced and can tell you what's normal, what's not normal. Sometimes you need someone that's just an emotional support to you. You might be fully knowledgeable about your choices and decisions in birth, but you need someone that can provide you that emotional support so that you don't have to do something so hard alone.
Yeah, everyone needs support, and not going through this alone and having extra support is so important. Maricia Owens is a registered nurse and one of Kimball's clients, and right now she's 33 weeks pregnant with her second child. She says during her first pregnancy, she had everything she needed for the baby, but missed the opportunity for self-care.
I decided to go with a doula because I knew that my second time around giving birth, I wanted that extra support. I don't live near family. All of my family is back in Texas. Now, even though I haven't delivered, has helped me a lot, even in the prenatal term, just because she's like a wealth of information. She's able to give me insight into different stretches to help me prepare for labor, different breathing techniques just to help me relax on a day-to-day. And then also just someone that I can go to just to kind of unload, because again, being so far away from family, I don't have that same resource and the same availability of those people. So she's been awesome even now, even before the birth.
She adds she would recommend a doula for other expectant mothers, even if you've been through labor before, because every pregnancy is different. Of course, doulas can't fix everything, and really they shouldn't have to if you think about it. Lasting change to healthcare disparities start with holding medical institutions accountable and giving Black and brown mothers accessible resources. Congresswoman Alma Adams represents the northern and eastern parts of Charlotte. She has really been an advocate on Capitol Hill to address this maternal health crisis. In 2020, she spearheaded the Black Maternal Health Momnibus Act. It's made up of 9 individual bills fighting for things like 12-month postpartum Medicaid coverage, investments in rural mental health, and maternal health, I should say, and the implementation of implicit biased trainings. Last night, Adams attended an event at Johnson C. Smith University. Important conversation here. She co-hosted it with the nonprofit organization Care Ring. It provides health services for the uninsured, underinsured, or those lacking access to affordable health care here in Mecklenburg County. City leaders and health care providers like Atrium joined Care Ring and Congresswoman Adams to learn more about improving the experiences of Black pregnant women.
And no mommy, no auntie, no sister, no baby should die.
The harsh truth is they are. Maternal mortality rates in the U.S. are significantly higher than other developed countries, and the stakes for Black pregnant women are high.
Doesn't matter how great your insurance is. I mean, when you think about Serena Williams and Beyonce, they too were victims in terms of what we say birthing while Black. And so that tells you right there that we have a lot to do.
More needs to be done. That's the message of the award-winning documentary Aftershock. It was screened for Mecklenburg County leaders and healthcare providers at Thursday's event, amplifying the unique stories of Black and brown women.
Manager, I'm really pleased to see you all here tonight.
Mecklenburg County Manager Dina Diorio was in attendance for Thursday's event. She talked about the steps our county is taking to meeting the challenges in our community.
Mecklenburg County cares very much about the disparities in maternal health. We currently have 8 core programs designed to address issues around maternal child health.
Some of the funding for those programs helped the nonprofit Care Ring. It was founded in 1955. Its mission is to empower our neighbors with limited resources to maintain good health.
2 of our programs are maternal child health focused. One is Nurse Family Partnership that's been with our organization since 2008, and the other is called A Guided Journey, and it's community health worker driven.
Shanavia Montgomery is the executive director of Care Ring. She says as we continue to battle the Black maternal health crisis, more people need to know there's help out there.
We are only scratching the surface of the need here in Mecklenburg County. There are nearly 7,000 women who qualify for our services, and we're only serving 1,000. So we are working with other programs who are serving other similar populations so that we can work together and try to solve this problem.
Working together to make sure Black mothers are heard and seen.
We want to make sure that not only do we continue to educate members of Congress, but to let them know that Black mamas of color, children, certainly deserve the kind of attention, and they do matter.
They do indeed. The conversation doesn't stop here. You can be part of meaningful change to improve Black maternal health outcomes. We have a link to Care Ring's website along with other local programs helping Black women trying to conceive or who are already pregnant. It's all there for you to view. Just go to WBTV.com/tonight.